Welcome, viewers. My name is Benson Mulaha, Medicwise TV, broadcasting from Mboita Hotel in Nakuru. Medicwise TV is sponsored by Radmed Connect Limited, your 360 radiology partner that deals with sale of radiology equipment, that is ultrasound, X-ray, and CT scan. We are at Mboita Hotel Nakuru. We are attending a Clinical Officers Association Symposium. And with me in the studio is one of the clinical officers who have attended this symposium. So he's going to introduce himself as we continue. Welcome, sir.
I'm Victor Kiprona, Clinical Officer Intern at Nakuru County Referral Teaching Hospital.
Thank you, Victor. I want you to tell viewers why you chose clinical medicine or become a clinical officer when young men of your age are aspiring to be pilots, others want to be sailors, others want to be engineers. They say they can earn more money than in being a clinical officer to be employed by the government. So what is your motivator towards becoming a clinical officer?
Okay, first of all, I would like to say that I chose to be a clinical officer because number one, is a good career that enable one to diagnose a patient. Me, for myself, I chose the course because I wanted to diagnose the patient, and I wanted to improve the quality of life to the society and all community at large. Yes.
So, Martin, you see, when you choose to become a clinical officer, you choose to serve the community.
Yes.
What are some of the common health challenges have you seen or you are seeing now in the community?
First of all, you may find that number one, like for example, there are those rural areas whereby they still believe in outdated things. For example, using of herbal medication. You find a client or a patient has come to your facility, already she has been using a herbal medication. So when you try to use drugs that are responsible or are supposed to be used in hospital setup, they are not making sense to them, or they develop resistance of drugs due to herbal medication at home. So those are some of the challenges that we find. And another challenges that we find from the society is that poor communication or language barrier from society. Most of the clients don't understand what you are saying. Working in those areas where there's language issues becoming a big problem to us. Yes.
So what happens when you meet a patient who has a language barrier, who cannot communicate to you? What happens in that case for you to be able to understand their ailments?
First of all, what we do, we have to look for a person who can help translate the language, or a person who understand the language, so that can ease the communication between you and the client. Yes.
Now, you said you're Douglas? Victor.
Yes.
In other careers, the elderly people would want to be served by people who are almost their age, as opposed to medicine. Have you ever had a patient who has not listened to you because he's looking down at you because of your age?
Yes, I've met several people like that, but when you address a patient in a professional manner, they will trust you. You know, first of all, you have to make a patient to trust you. You have to win the confidence of a patient, so that when you address the patient, or when you work towards assisting the patient, you have to behave in a professional manner, so the patient will accept your work to him.
So, Victor, you said you are an intern.
Yes.
You are still studying. So how do you get updated with advancements and changes in the medical healthcare department or system?
First of all, me, I usually do attend CMEs. I usually read the books and the protocols. You know, in medicine, things usually change every day. There are updates every day now and then. When you have something like CMEs, training, I usually attend so that I become up to date. Yes.
Now, I am sure you have had situations that are emergencies. Take, for example, a patient suffering from pressure or an asthmatic attack is brought in and you have a patient. How do you handle such a situation that needs emergencies?
First of all, there's something called triage. In a triage, you have to identify the critical patient or the patient who need first attention. So in that case, when you do a triage, a patient who need critical attention or first attention, you first attend to him. It depends on the case. Sometimes are RTA, hypertension, you have hypertensive urgency and the rest, which needs urgent attention. So that's how we do it. We do by triage. Yes.
So you are very you are very limited with your words. You do not want to speak too much. Now, what kind of advice will you give to young people like you who want to become clinical officers or health professionals?
First of all, I would like to say that you should be determined. You should focus and should be ready to study and should be ready to adjust with the environment and with time because everything changes. When you come inside this profession and a bit aside you backslide or you are not attending this CMEs or meetings, you're left behind. So when you decide to become a professional like this, make sure you become a good person who don't miss many of these things.
So you are saying that the medical profession, if one has to succeed in medical profession, he must keep learning every day, or anybody who puts down books, what happens to their profession? How do they really deal with such a cases?
Such cases, for example, even though I've not get your question well, number one, you should be up to date. For example, timekeeping.
Good. I meant to ask that if somebody does not study, if somebody does not continue learning or attending symposiums like this, then he will become obsolete in medicine or he will become obsolete as a clinical officer?
Yes, in fact, you'll become obsolete in medicine. If you don't attend such things, number one, you'll not be updated. So you'll be back. For example, in the medicine field, you see there are some drugs, usually they are going up outdated. So you will find that those medicines are no longer prescribed. So you should attend things like this so that you'll be up to date.
In this symposium, we've been talking about doping. And young men like you are in drugs. What happens when a patient is brought to you and you diagnose him and find that he's a patient of doping?
When you find a client or a patient who has doped, number one, you have to report the case to the appropriate board so that they can take appropriate measures because that is beyond you. Yes.
Okay, thank you very much, Collins. You are a man who is very mean with his words. And I look forward to interacting with you in another session sometime because I know you have a mind that wants to learn and you are going to be in this system for quite a long time. I believe that you will continue doing what you are doing so that you can come out as a successful clinical officer in the world of medicine. Thank you. God bless you.